Hello, everyone, and welcome to this audio podcast. This audio podcast, as part of a quantum edition. This audio podcast is part of a Vortux Gauntlet, and this audio podcast as part of a Lobostic sequence. This audio podcast as part of a Storm Lobostics production. In this audio podcast, I was part of this audio podcast, and sort of continuing on from audio podcast in this sort of edition this audio podcast. I will look at bridging the awareness gaps in bridging the awareness gaps in chronic kidney disease, or CKD, and looking at education, sort of the educational aspects in context of healthcare services, in context of healthcare services in primary care. And this works was a research. This was a research poster presentation that formed as part of a healthcare awareness event that took place in the Southwest region in the United Kingdom in around 2014. The aims and objectives were number one, to highlight highlight the gaps in chronic kidney disease (CKD) through literature. Two, to highlight an intricate understanding of how there should be collaborations or collaborative efforts between primary and secondary care for for the increasing number of suspect and high risk recipients or patients. And three, to inform how primary care teams can be more proactive through the use of social media, providing a renal patient support group, RPSG, an example. The RPSG, an example of a social media platform, where people where healthcare service users and carers and so on utilize to share lived experiences. So a bit of background to this research poster presentation from 2014. So in the National Service Framework for Renal Services from 2005, and a progress report from the Department of Health, or DOH. There were many parts where healthcare services had been improving, had been improving or had improved, and where efforts had also been concentrated and in regard to sort of nephrology services. At the same time, there have been many differences of how care had been and is projected, and how it is actually sort of evidenced. Um, it seems that there is, or it seems that there is a consensus or understanding that early referral, so patients who are suspect or high risk, where there is early evidence around in regard to early referral, between healthcare sectors or services, is important to allow best prognoses for suspect and high risk and newly diagnosed renal patients. But the transition for individuals at suspect or at risk between healthcare sectors can also be somewhat of a conundrum. There are many There are many factors that will influence sort of timely referrals for suspect and high risk patients, and because because renal impairment is a silent condition, and this makes it all the more challenging or complex to transfer patients or recipients sort of rapidly. Thus patients or recipients could, for example, have high estimated glomerular filtration rates but renal function still remains within normal pathophysiology, normal pathophysiology. So now looking at some parts of the some parts of the literature from this works, and looking at looking at gaps in CKD, chronic kidney disease awareness before going into CKD or chronic kidney disease awareness, more specifically in regard to primary care. So the gaps in chronic kidney disease awareness. So between 2005 and 2009, the prevalence of CKD stages 3 through 5 increased from 0.3% to 3.9%. And in 2009, just over 30,000 recipients or patients fulfilled biochemical criteria, thus had the biochemical criteria applicable or associated with the laboratory medicine guidances for chronic kidney disease (CKD), but were not on primary care practices or surgery chronic kidney disease CKD register, and just over 60,000 patients or recipients, just over 60,000 patients or recipients were included on a practice or primary care surgery or practice a CKD chronic kidney disease register, but did not fulfill the biochemical criteria in context of laboratory medicine guidances. This also, listeners, is referred to where they did not fulfill biochemical criteria or laboratory medicine guidances. It has been referred to as miscoded CKD chronic kidney disease within the literature. So for patients with confirmed CKD chronic kidney disease, inclusion in a practice or primary care surgery or practice registers was associated with increasing age, and where there was increasing age and where there had been a male gender dominance, and also where there had been associations or an affiliation to other primary health conditions according to primary care practices. In one investigation, the mean age in another investigation, the mean age of a cohort at the beginning of an investigation, the jury of the investigation, 60 just under 65 years, so 64.8 years, and 55% there was of 55% of 55% of the cohort were and had a female dominance or predominance in those patients or recipients with CKD stage 3 through 5. 83.9%, just under 84%, were or had symptomologies in regard to hypertension, and defined by the criteria or by and through what have been referred to as the prepay for prepay for performance prepay for performance or P4P sort of a criteria or guidance in context aligned to literature in context of literature and guidance in regard to chronic kidney disease and CKD and wherein within the cohort the ABP arterial blood pressure had been as part of the cohort within the cohort or within the P4P within the P4P the cohort had an ABP of 140 over 85 and had been current and had at the time had also been taking or prescribed antihypertensive pharmacotherapy. Population arterial blood pressure or ABP control had improved since the induction of P4P renal nephrology indicators or renal indicators or symptomologies, and this improvement had been sustained, and this was associated or affiliated with a significant increase in the use of antihypertensive pharmacotherapy, resulting in increased prescription costs. Thus, primary care physicians were and had been prescribing antihypertensive pharmacotherapy, thus increasing sort of the prescription costs in regard or sort of in as part of the P4P, and longer term follow-up had looked to establish or identify whether or not this had translated to actually improving outcomes in terms of CKD progression and symptomologies aligned to patient or recipient mortality. And within the literature, it is where this has meant more awareness has required collaborative efforts and collaborations between healthcare sectors and between and perhaps more specifically between specialisms in sort of within the secondary care sector and within primary care sector, and Now going into a little bit in regard to the CKD awareness, sort of in primary care, sort of more particularly or specifically. So one investigation explored newly diagnosed CKD patients referred to nephrology clinic with open-ended open-ended questions in regard to understanding CKD causes, symptoms, and management. It works by Burke and team in 2014 had surveyed 210 patients or recipients, wherein the median age was 60, where the median age was 66 and a half years, and where the cohort or the recipients primarily were from a female background, in around 50.5%. The prevalence of risk factors included many or varying primary health conditions, primary health conditions and symptomologies and risk factors, and linked to or had some associations with chronic kidney disease or CKD, and CKD stage prevalence was CKD stage and prevalence was 8%, where the prevalence was zero was 8% at zero. CKD stage prevalence at CKD stage 1 was 24%. CKD stage prevalence at CKD stage 2 was 11%. CKD stage prevalence at CKD stage 3 was 38.5%, and CKD stage 4 prevalence was 18%, and CKD stage 5 prevalence was 0.5%. What this informs is within the generalities of primary care surgeries or primary care practices. Primary care practices is that within primary care, the number of CKD stage patients or recipients at, for example, CKD stage 4 and 5 are not prevalent, whereas within CKD stages CKD stage 3, wherein CKD stage 3, the prevalence and even sort of the incidences is higher. At the same time, 18% excuse me, data 18%. At the same time, 18% of the cohort, within the cohort, in works by Burke and team in 2014, 18% were primary school educated, 82% were referred by a primary care physician, and 29% had seen a nephrologist previously. Had seen a nephrologist previously. 16% were unsure why they had actually been referred. CKD causes were identified by identified by patients or recipients were and also sort of varied from unsure to varying other sort of sort of primary care conditions, and where for example symptoms or symptomology identified also included asymptomatic, so unknown unknown symptom or symptomology in around 16%, and renal pain or kidney pain in around 17%, and other in around 42%. And so management had suggested in management in works by Burke and team in 2014 had suggested patients were uncertain in around 51%, and were and where wherein and wherein in around 30 wherein around wherein around 32% were on a form of renal replacement therapy, and on anti hypertensive pharmacotherapy in around 16%. 82% had reported unsatisfactory education from their primary care physician, and new patients referred to a renal outpatient division had poor knowledge of CKD or chronic kidney disease. Education of patients should according to works by Burke and team in 2014, education of patients should begin in primary care, within primary care, before referral, and education needs to be targeted simplistically, simplistically, and even perhaps where general practitioners should look to get more involved in should look to get more involved, or where there should be patient involvement through patient involvement patient involvement and healthcare primary care physicians involved through online groups, or online social media sort of platform. And now going into a little bit in regard to the awareness through social media, and sort of providing or highlighting some of the works by the RPSG, or the Renal Patient Support Group, the RPSG. So the RPSG had been founded in 2009, founded in 2009, and is now a sort of an internationally recognized patient and carer sort of platform, where it is generally voluntarily led, and at the time of this particular this research poster presentation, the at the time of the research poster presentation, the RPSG had just over 5,000 healthcare service users. There are 10 or 11 members to the administrative or research team, with representation from the United Kingdom, Europe, and at the time Australia, and also the United States, who are involved in facilitating and moderating the social media platform. The RPSG aims to raise a CKD, chronic kidney disease awareness at all stages, with members providing insight on lived sort of experiences. RPSG has also encouraged members and prompted members to gain sort of an in-depth understanding on topics surrounding CKD, and linked to solid organ transplantation, and the social media platform has also lent itself well to raising CKD awareness, to raising CKD awareness, and the um, the social media platform is also or has been involved in varying collaborative efforts to support renal and nephrology relating sort of projects by by involving researchers and investigators, and linking works to sort of best practices, and linked to at the time, and linked the to one of the initial social media platforms being Facebook at the time in around 2014. The RPSG was or had been on Blogspot or on Blogger for those who do not use who do not use or did not use Facebook, who did not use Facebook, for example. Within the research poster presentation, there is an overview on what's on the RPSG, and what's on the RPSG. There is a publication. There is a publication that a publication by works by Mohammed and team from 2014 that also that also highlight some of the works and sort of the basis in regard to the RPSG, highlighting or sort of outlining some some of the sort of crux around the work of the social media platform. The research poster presentation, and now going into what needs to be done in primary care. So general practitioners or primary care physicians need to further understand the implications of CKD for individual patients, whom are listed suspect or high risk, to appropriately flag electronic and manual records in order to maintain safe prescribing and safe healthcare for CKD patients or recipients. Primary care physicians to consult appropriately and applicably with specialists when the management of intercurrent illness has specific CKD implications. Primary care physicians also not to wait until it's too late and then give recipients or patients essential information relating or regarding to CKD screening and prevention. And primary care physicians should be more active or involved and utilizing or using literature from appropriate organizations. So for example, not to promote too much at the same time. For example, UK Kidney Association and the renal registry, and amongst published literature identified through varying medical and sort of clinical databases, and also get involved in patient-led initiatives like the RPSG, by contributing through awareness. And then now sort of some conclusions. So whilst CKD in some part, not completely, has also been referred as a terminal condition, death is usually not a sudden occurrence. More commonly is as a slow decline in general health, and in general health, and a sort of a wasting relating to biochemical metabolic and biochemical disturbances, inability to excrete excess fluid and acid, the production of which overwhelms the natural corrective mechanisms or mechanistics, eventually, and unfortunately compound the compound sort of renal pathophysiology. People all amongst the population are now living longer, more awareness at low and local sort of solutions through primary care and through our online groups, will be required to help inform and deliver health improvements in recipients or patients at an early stage in CKD, or in those recipients or patients who have not yet developed who have not yet developed what is also referred to in the literature as full-blown CKD. Full-blown CKD or chronic kidney disease. That draws this audio podcast to a close. They're in on social media, and with this audio podcast, there will be a list of references that listeners are more than welcome to refer to sort of interact on social media, and through this audio podcast. This is an audio podcast as part of a quantum edition, an audio podcast as part of Vortux Gauntlet. This audio podcast as part of a Lobostic sequence, and this audio podcast as a storm Lobostics production.